Good afternoon. Welcome to All Things Physical Therapy. Today we're going to talk about a walking program. And today the walking program is going to be geared more towards the elderly patient who might be starting to get a little bit weak or a little bit deconditioned, and they'd like to do more as far as exercise goes to stay fit, but they really can't because they can't do much. They've gotten so weak or having so much problems that doing a real advanced exercise program is hard. So we're going to do a real simple exercise program. Today we're sitting in my yard, sitting by my garden. We could do this program in the house, but it's a nice summer's day. Let's go outside and enjoy the day while we can. We're going to walk on ground today instead of a driveway. If you're not able to walk on ground because it's too unlevel, that causes you some difficulties, by all means walk on a driveway or walk on a sidewalk that's more level and makes it easier for you. But if you have an unlevel surface, that makes it a little bit harder and makes the workout perhaps a little bit more successful for you. Depends what you're looking for and depends what you can do. Just sitting in a chair out in the lawn. Now, before I walk, I might want to do a little bit of warm-up exercise. So I might be sitting in the chair and I might do some knee extension work to help get those knees ready for some walking. Now, every exercise I do, I try and do somewhere around 25 reps. I'm not going to do that right now for purposes of time. But we're looking at getting those knees, just making sure they're nice and strong, nice and straight, ready for a little bit of walking. I'm going to come up to my chair. Now, you don't have to turn the chair sideways, but I'm doing that because we have a camera here. I'm turning the chair sideways. And now, in the standing position, I'm holding the chair for balance. I can do some kicking exercises where I'm kicking my leg out sideways, 25 times on one side, 25 times on the other. I can kick straight backwards. Again, a nice hip exercise, a little bit of strength, 25 reps on one side, 25 reps on the other. Taking my legs out sideways, taking them back. Now I want to lift them up in front of me. 25 times on one side, 25 times on the other. Okay, we've done our knees, done our hips. Let's throw the ankles involved in that. Do a little bit of balance coordination, rocking up and down on our tiptoes. So just sitting here in my lawn, I'm able to do a real nice leg strength exercise, getting warmed up for a walking program. But maybe I'm tired now, so I have to sit down and rest. And I might rest for 30 seconds, or I might rest for a minute, or I might rest for 5 minutes. But I'm not going to go in the house and rest for 2 hours. It's very unlikely you need to rest that long, and you're not going to be motivated to keep exercising if you walk away from it. So stay in your chair, rest until you feel like walking, and then it's time to get up and walk. When you stand up, chair might be a little bit low like this one is. Remember, the trick to standing up, lean forward. If you try to put your hands on an armrest and go straight up, you're going to get stuck. It's hard to get up at that point. So instead of pushing up, I'm pushing myself forward and then standing up. I'm going to go for a simple walk right along the grass, enjoy my garden, walk about half as far as I think I can, come back, sit down and rest. I love this garden. It's beautiful. This gives me a chance to actually go out and enjoy the garden that somebody planted. I planted it in this case, but if your family did it, and this is a chance you go sit in your family's yard, sit there and enjoy their garden that they put together for you. And again, it's not just one walk you want to do. I want to sit here until I'm rested, whether it's 30 seconds or a minute or 5 minutes. And then when I'm rested, go for another walk. And then I'm going to sit and rest again. And then I'm going to go for another walk, and I'm going to try to do that at least for 15 minutes, but preferably maybe for a whole half hour. You might need to sit in the shade if it's a hot, sunny day so you don't get too tired. You might want to keep a water bottle with you so you have something to drink in case you get too thirsty. Have the setting prepped for you. But prepare yourself to do that exercise program, and don't do it once. Do it every day. Do it every other day. Do it 3 days a week. Do it 4 days a week. And you'll notice a training effect, just like runners or any athlete does. The more they do something, you'll get the same training effect from walking. That's our walking program for all things physical therapy. I hope it works for you. Thank you.